So now to the question. What is the difference between a limited panel and a comprehensive panel,
Yeah,
and what should we be looking at?
that's a great question. I think that this is probably the most critical question you've asked so far is what's the best way to find out the genomic underpinning of the tumor? And this is one of the most fascinating, fields right now is optimal ways to test. And I think the old way of testing for lung cancer was through what's called a limited panel, which, believe it or not, required a fair amount of tissue, a fair amount of DNA from the tissue biopsy. And it looked at just 3 or 4 genes, specifically EGFR, ALK, and ROS, sometimes KRAS. Again, these are 4 genes that are common in lung cancer. And so if you just want to look at the common genetic mutations for all lung cancer, why not just look at 4? And I think what we've learned over the past 5 years is that there's been convincing data and convincing evidence that if you do that, you will miss other mutations that would allow you to deliver targeted therapy or oral therapy. You will miss what we call actionable mutations, mutations that you can act on with a pill. And so this has changed the way we think. And over the past, I would say 5 years, we've really made a push for comprehensive genomic profiling, otherwise known as next generation sequencing. That's the buzzword. That's what you need to ask your physician. Has your tumor had next generation sequencing? It sounds like something out of Star Trek. It is not. It is what we do for every single patient that walks through the door. I'm passionate about this. I think that there are platforms, next generation sequencing platforms that can be done internally, meaning it can be done in an academic institution. But fortunately, there are commercially available assays too that any oncologist can send their tissue out to. And this is standard of care in my mind. Every single oncologist who's treating a lung cancer patient needs to send tissue out to a next generation sequencing or comprehensive genomic profiling that can capture more than generally 300 genes. That we're talking usually about 3 or 4 genes. Now we're looking at 300 genes or more. So that's really where we've moved the field, is with this comprehensive genomic profile, and we know by doing that we should really be able to deliver the best therapy for patients, personalized therapies and targeted therapies, and capturing the genetic alterations.
That's
Hallelujah.
that's great. Yeah,
Thank you.
yeah.
You're preaching to my choir.
Yeah.